Hi, I'm Joe Flynn, Executive Director and Physician-in-Chief of the Norton Cancer Institute.
Thank you for joining us today, Dr. Flynn. We're going to be asking you some questions about e-cigarette use, beginning with how were e-cigarettes developed? How did they come about, and what are they?
So they were first actually, if you really look at the history of e-cigarettes, it has a fairly long history in decades, but really over the last, since the really late 1990s was when they really came to form, first overseas in Asia and then the United States. And what they really are, we talk about them as e-cigarettes, but they're really a nicotine delivery device. And what they are is a battery with a heating coil and fluid. And the battery heats up the coil, which causes the fluid to evaporate, causing a vapor. And whatever's in that vapor is inhaled, and that takes a replacement to deliver nicotine predominantly.
Wow. So should people use e-cigarettes as a nicotine replacement product to help them quit smoking?
Great question. There's a lot of controversy on that. If you look at, when we say e-cigarettes, we think of it as one product, but it's really dozens of products. It's not just the e-cigarette, it's the fluids that people use, whether it's cinnamon or licorice, and there's all different types, and they all have different levels of nicotine. So in some ways, yes, you can use them. In fact, some studies have shown them comparable to other nicotine replacement therapies, but it's controversial because you don't really know that you're getting a prescribed dosage of nicotine. And when you look at stopping smoking, it's really having a good sense of the level of nicotine replacement for what the person actually smokes in regular tobacco. So it becomes complicated because some studies have shown that they're actually comparable and other studies have shown that they're not. So if you really want to kind of tear that down a little bit further, I would say if you're a heavy smoker, that trying something that actually eliminates you from smoking is important, but we know that using things with counseling and other programs along with nicotine replacement is really your best chance of quitting.
So with that being said, if someone was interested in quitting smoking, are e-cigarettes safer than smoking tobacco?
Well, this is where we don't know the answer. If you look at, so it's a great delivery system for nicotine, and you can say nicotine is not the thing that really hurts people in a general sense. However, we know that if you're pregnant, nicotine can cause various problems for people with heart disease, causing palpitations and raising heart rate and other problems. So nicotine is highly addictive. So anything that's addictive in this day and age, the cost is a problem. So you think of the cost that people are getting into. So there's the addiction piece. And then there's things, depending on the fluid that you use, there's some studies showing formaldehydes generated, acetaldehydes, so things that actually are carcinogens. Because we haven't really seen the long-term usage of these products, we don't really know the long-term effect. There's a lot of studies now showing that in the lab and in mice models it actually causes damage to the lungs. We know that people who use e-cigarettes have a higher incidence of pneumonia and refractory pneumonia. We know that people, especially if you start in your adolescent years, that those people have a higher incidence of chronic bronchitis than non-smokers. So the answer is really complex. Now, compared to taking in tobacco and tar and nicotine and all the other, not the nicotine, but the tar and other toxins, it's probably going to be better. We just don't have that long-term effect. If you think about tobacco use, back before my generation, they used to have doctors there with their cigarettes going, I prefer Camels for my patients, but as we found out that it's actually, it's one of the most deadly things that we do in our society. So that's an awful answer, but there is no real discrete answer. I'd say that there's real advantages if it can help you quit. The problem really is, and I'll go on a soapbox for a second, that if you look at, right now it's estimated that 16% of young people use e-cigarettes. That if you look at in college, one study showed 40% of college students have tried e-cigarettes. You say, no big deal, except for the fact studies are showing that if you use e-cigarettes and have never smoked, you're at a 2 to 6 times increased risk of using tobacco later on in life after 2 years. So it's kind of, you hear the term entry drug, but in some ways it's an entry drug. It's getting people addicted to nicotine, and so it's not all that it's cracked up to be from that standpoint.
Thank you for that. That was very interesting.
Probably too much in depth,
Absolutely.
but that gives you a perspective.
Not at all. So with that being said, though, the CDC currently says that e-cigarettes have far fewer toxins than conventional cigarettes, which you have agreed with. So why issue warnings?
Well, because again, just like we talked about tobacco use, we don't really know the long-term effects. We know that in the lab they show damage to certain cells that long-term you don't know. Nicotine being a chemical, it should be regulated. One of the things that this is a personal opinion, that if they were able to regulate it better, and you'd have a known quantity of nicotine in the sample, you'd be much more able to know the benefits and risks. Because there's such variation that you're not able to say that, and you don't really know what's going into that. They use glycerin. Glycerin, when heated, can actually produce carcinogens. There's other things. So without regulating it, you're vaporizing whatever somebody decides to put in that little tube of fluid.
So discuss some of the current regulations around e-cigarettes.
This is where, again, going into the history of it, this is where it's difficult. Every state is different. So some states have regulations where you cannot sell e-cigarettes to people under age 18, yet they can possess it. Kentucky, you can't sell to people under 18, and they're not allowed to possess the e-cigarettes. Along with that, there's different regulations on where you can and can't smoke that. A lot of states, and including Kentucky, you cannot, wherever there's a ban for regular tobacco use, you can't use e-cigarettes. You can't use e-cigarettes in federal buildings. There's very discrete, but there's 50 states and there's 50 different regulations based on the states.
So for someone who is looking to quit smoking, what are some of the pros and cons that tobacco user could consider when switching to an e-cigarette?
I think there's two things. If you think about why people smoke, there's no natural thing to say, I'm going to put this hot smoke into my lungs, it's going to be soothing, I'm going to feel better. It's an addiction. Nicotine is a highly addictive drug. So from that vantage point, people were really addicted to using tobacco to try that, to get rid of that habit, because people have an oral habit just by doing something. So they talk about eating carrot sticks or celery to kind of get rid of that oral fixation, but to use that along with having some replacement of tobacco so you lose that craving over time. Some people quit and just one day they say, I'm done smoking, but most people need to have they have what we call recidivism, meaning they quit and they start again, they quit and they start again. So having something that replaces that logically can't be all that bad. It's better than smoking, but to me you got to have the counseling piece of it. You have to have the change in behavior. You have to change the cues. You have to change the setups of when you're normally. Some people smoke only when they're out drinking. Some people smoke after eating. Some people, after a day of work. So eliminating and changing those up really are going to give you the best chance to quit. If you look at it nationally, with a lot of our smoking cessations, 6% of people quit after trying. It takes a lot. So those numbers are increasing to 18 to 30% depending on the program. So it really takes a lot of different things. And I don't have as big a beef. If you look, there was a New England Journal article recently, and they talked about the pluses and minuses for e-cigarettes in the quitting pathway, and it's a lot of controversy. If somebody said, look, I think I can do it this way, I as a physician wouldn't have as many beefs as them continue smoking 3 packs of cigarettes a day.
Can you talk a little bit, lastly, about kind of what Norton Cancer Institute is doing in terms of smoking cessation classes, and a little bit about the Great American Smokeout this Thursday, November 17th?
Sure. Being in cancer, obviously we recognize Kentucky, #1 in incidence of lung cancer, very high in head and neck cancer. We have the worst outcomes in lung cancer. So if we can actually prevent that, our smoking rates are 12 to 13% higher than the national average. That's a lot of patients or people who are smoking. So our focus is to say, look, as a cancer institute, we recognize preventing is always better. So as a result, we've worked to this Freedom from Smoking program, and we're working with UAW and Ford. We're really going out and opening up to all the community to come in and say, we have it's an 8 class program where they come in and they get both nicotine replacement, but also the counseling and give tricks and ways to overcome that habit part of it. And it's really a commitment for Norton Healthcare in general, and we're doing that in combination with one-on-one programs, group programs, nicotine replacement, and really working with the patients to help them quit. And the Great American Smokeout is really that time in the year where you just say, okay, it gives us a cognitive point in time to say, here's as good a time as any to quit smoking. And you can pick any day you want. It could, but that's, as a nation, that's a good time to get around that. And I think, in credit to the Norton Health system, I think there's, whether it's family practice, you name the clinical groups, everyone's kind of all hands on deck on trying to do that.
Wonderful. Well, thank you so much for joining us today. We've learned a lot of information.
No, this is fun. Thank you.
Great. Thank you.
Great.